The princess received a diagnosis known to many Canadians. Here to explain more about what that's like is Dr. Timothy Hanna, a radiation oncologist. He joins me now from Kingston, Ontario. Doctor, thanks for being here. You know, people have been concerned about Kate not being in the public eye while she was recovering from abdominal surgery. And now we learn that she is undergoing preventative chemo. How difficult is it for patients undergoing these types of treatments to maintain their everyday life?
It can be quite difficult. Kate has just come through a major surgery. She's recovering from that and starting right into quite significant therapy. On top of that, she's recovering from the shock of a completely unexpected cancer diagnosis, dealing with how that's going to affect her children, trying to communicate that and deal with the public eye. On top of all of that are the side effects of chemotherapy, which can cause fatigue, nausea, vomiting, trouble with the digestive system, and trouble with blood counts, among many other things. So this is quite a lot, and typically these treatments go on for months.
I know that you're not a royal commentator, but dealing with patients going through similar things, what do you think makes it so important here for Kate and her family to be out of the spotlight at this time?
I think it's incredibly important, number one, just for allowing time to physically recover from this major surgery while going through all of this chemotherapy. But just dealing with the emotional toll of this cancer diagnosis is big. She has 3 young children, age 10, 8, and 5, and this is a lot for them to understand, to comprehend, and process on top of its effect on her larger family. So the emotional and physical toll is large, and I think any family would want the time to deal with this, especially when this cancer diagnosis comes at such a young age.
Kate said in that video message she put out earlier today that she's undergoing, quote, preventative chemotherapy. What exactly is that?
When one undergoes preventative chemotherapy, this is usually following your main treatment. This is typically a surgery. Sometimes it might be radiation. When you're undergoing preventative treatment after your main treatment, which is sometimes called adjuvant therapy, it's because there's a risk that the cancer will come back if nothing further is done after the main treatment. This suggests that there is such a risk with Kate, which suggests this is probably at least a stage 2 or stage 3 disease. So this is a quite significant situation for her to be going through right now.
So just to loop back on that, she previously said that this was non-cancerous, but only after the surgery they learned it was. Does that happen often with patients?
So it certainly can happen. And most of the time when you're preparing to do a surgery, you know that you're going in to treat a cancer. This obviously wasn't the case for Kate, and certainly incidental findings happen both at time of surgery and when imaging is performed or other physical exams. The fact that there was no release of a cancer diagnosis into some time after the surgery would be not uncommon in this situation, because the surgeon would want to wait for the pathology report to be reviewed by a pathologist and a final definitive report to be brought out.
How difficult could this chemotherapy regime be? I know that we don't have a lot of details here, but from what we do know, how difficult could this be, and what could the recovery time look like?
Yeah, so typically with these adjuvant or preventative treatments, they can last 3 to 6 months. Sometimes they can last a year, just depending on what type of cancer it is. So it's a lot of visits to the hospital. It takes a lot of personal time, a lot of personal energy, and the side effects can be substantial. Sometimes people get into more serious side effects that land them into emergency rooms or require hospital admissions to deal with. For example, if you get into an unexpected serious infection because your blood counts drop. Really, I mean, it's common for people to get through this safely, but it can be a long road with quite a significant physical and emotional toll.
And we wish her the best in that road ahead. Doctor, appreciate your time and your expertise tonight. That was Dr. Timothy Hanna, a radiation oncologist, joining us from Kingston, Ontario.